Pulpotomy Technique. This video demonstrates a predictable and reliable method for carrying out the pulpotomy of carious deciduous molar and subsequent restoration with preformed stainless steel crown. Aims of pulp therapy for cariously exposed primary teeth are to conserve the damaged tooth and restore its function until the permanent successor erupts. Successful pulp therapy reduces the need for unplanned extractions and its undesirable consequences that may follow the extraction process. These are the instruments and materials that you might find useful in carrying out pulpotomy procedure. It must be noted that clinically, when undertaking this procedure, local anesthesia is required. Rubber dam should be used throughout the procedure. This is to protect the airway, increase patient comfort, and reduce the chance of bacterial ingress. Thread floss through the holes on clamp. This is to facilitate retrieval of the clamp in the event of aspiration. Punch appropriate holes on the rubber dam. For this will be the tooth undergoing pulpotomy and those immediately adjacent to it. Then gently try the clamp on the tooth. There are many techniques for rubber dam placement. For ease, a split dam technique can be used. For this, the interproximal dam between the holes is cut. This is particularly useful if the tooth is going to be restored with a preformed stainless steel crown. Once you are satisfied, ensure the dam is fully seated by flossing through the contact. The dam can be further secured using rubber or wooden wedging material. Gain access to the caries using 330 burr within the high-speed handpiece. Ensure clean margin circumscribing the cavity is established. Deepen the cavity and remove the caries overlying the pulp chamber. Widen the cavity sufficiently to ensure access to the pulp horns. These are usually located in the corners of the tooth. Then, gain access into the pulp chamber using high-speed handpiece with a diamond burr. Ensure all overhanging dentine or roof of the pulp chamber is removed. At this point, you should observe bleeding from the pulp. If bleeding does not occur and the pulp appears necrotic, it can be assumed that the pulp is non-vital and pulpotomy would not be the appropriate choice of treatment. Remove the coronal pulp tissue with large rosehead burr in the slow handpiece. Alternatively, a sharp, large excavator could be used to amputate the pulp. The pulp stumps should be visible. Care should be taken when removing pulp tissue overlying the cavity floor, as this is very thin. Overzealous preparation could result in iatrogenic perforation. When you're happy that inflamed pulp has been removed, now is the time to achieve hemostasis. For this, cotton pellet moistened with formocresol or cotton pellet soaked in ferric sulfate is placed onto the remaining pulp tissue and canal entrances. Use tweezers to deliver the cotton pellet into the excess cavity, pressing firmly on the pulp stumps. Leave the formocresol in contact with the pulpal tissue for 4 minutes, or ferric sulfate in contact with the pulpal tissue for 1 to 2 minutes. Gently remove the cotton pellet and observe hemostasis. If hemostasis does not occur, repeat the placement of formocresol or ferric sulfate for 1 more time. Fill the pulp chamber with a zinc oxide eugenol material. Use flat plastic and the plugger for packing this material into the pulp chamber. And finally, restore the tooth with stainless steel crown.